Welcome back. The President will address the nation tonight at 8 o'clock following the detection of a new variant of COVID-19 that has sparked alarm around the world. It's unclear where the variant, now called Omicron, originated, but it was first detected here in South Africa by scientists. After the news emerged earlier this week, world markets fell and countries around the world started imposing travel bans on southern African countries. It's not yet clear how serious the variant with the highest number of mutations is yet. While the health department has called the almost immediate flight restrictions unjustified, government now has to decide on South Africa's internal response. Gauteng is the most affected province by COVID-19 right now, but cases in other provinces are climbing as well. On Friday, the number of new cases jumped by more than 1,500 to reach 2,828. Yesterday, 3,220 new cases of COVID-19 were reported and 8 new deaths. We're still nowhere near the numbers recorded at the peak of the third wave, which were above 20,000 per day. And the fourth wave has not yet been declared officially. So what might the President do tonight? What should he do? To discuss, we're joined by political analyst Sanusha Naidu and political economist Lumkile Mondli. Great to have you with us both. Let me start with you, Sanusha. If the health department says these flight bans are unjustified, surely we have to be tempered internally. The ANC also counting the political costs, saying that the lockdowns hit it at the polls, and then there's the economy on its knees and people's lives affected by whatever is decided tonight.
Yeah, good evening, Francis. Good evening to Lumkile and to the viewers. I think it's it's a difficult situation right now, particularly because we are coming out of a local government election where, as you rightly point out, the ANC is basically finding itself in a very invidious position. I don't want to talk about the economy too much because Lumkile is the expert here. But I think given the fact that we are sitting with such economic crises, people are finding it difficult, and you're looking at inflation, you're looking at cost of living, you're looking at the fact that the price of oil went up and that caused a run on our currency. You're looking at the currency fluctuation. All of this is going to be impacted on. And I think the challenge for the president is how does he manage a light lockdown or keep the lockdown as is, as certain sectors of the economy and social spaces are calling for, but also try and get people to become much more vigilant about their own risk and how do they become risk averse. I know that they've been talking about perhaps if the spike continues, if the numbers continue to increase, if the positivity rate continues to increase, then of course mandatory vaccination. Then we know that the government has gone out on the whole weekend vaccination drive, but that needs to be much more intense. So I think at the end of the day, the challenge is how do you police people's behavior? People are really frustrated. People are feeling quite, sensitive about being in lockdown mode. You're coming out of a winter, you want to be out in the sun. And this again means that, if it continues in this way, we're going to see the frustration spill over. We also know that there are people out there that don't feel that the vaccine works for them. And then, of course, you've got the other issue here, and that is whether you need to have a third vaccination or a booster to what you've already taken. So all of this is also very complex for the country in terms of the cost that this is going to create for us in terms of our economy and so forth. But I think the challenge right now is, does the president look at this and say, well, I'm going to manage this in a way where I keep the level 1 lockdown regulations, but at the same time, what do I do with the National Disaster Management Act? Do I continue in that mode, or do I find another kind of alternative? I think all of this is up in the air, and I think the reaction to South Africa being placed on travel bans and so forth is not helping the situation. It would be very important for us to understand how much of the new numbers we are seeing on a daily rate, 24-hour rate, is actually being detected by this new variant of the Omicron, and how much of that is the spike. So I think it's important that we understand the science, but also understand the political, socio-economic challenges that we face.
I agree. To what extent is the new variant driving the infections and adding to that frustration? Lumkile, many people hoping to go home, hoping to enjoy a holiday, enjoy some drinks over that holiday. Is there a way that the president can introduce some light restrictions, as many are calling, without harming the economy, and what would those be?
It's self-regulation, and good evening to you, and good evening, Sanisha, and the viewers. Self-regulation is very important. We've seen that, for example, in the hospitality and leisure sector, there's been a huge drop in the level of compliance. For example, checking temperatures, registering us when you come in, but more importantly, they now need to step up as well on themselves, asking for us to produce our vaccination cards if we're going to sit down. Otherwise, everyone who's coming to a public area, such as a restaurant or a place of enjoyment, a shebeen, that person who's going to sit needs to produce that card and do the rest, temperature and writing down his or her details. So that's the only way I think the president can encourage us to enjoy the period through the presentation. I think the hotel and restaurant organization have made those presentations, and they have to lead on their sector. More importantly as well, Francis, is that if we do that, if the hotel and restaurant sector does what I'm suggesting, at the same time ourselves as families, we take also our own regulation. For example, we're allowed to gather, but I mean, in my household, we have got a rule that you don't come to our house if you're not vaccinated. And I'm very happy that my family, as well as my extended family, has cooperated. So similar behavior need to be encouraged by everyone. But where we've seen a huge disappointment, Francis, has been at the political level, where political parties, including our government, has really sent mixed messages, giving individual liberties, where in fact, this is a public interest issue. So I'm expecting the president to really go beyond sitting on the fence and being like an economist, like such as me, where there's one side and on the other side. What we want now is a straight message that vaccinate do allow us at least to let the economy continue operating, but more importantly also, while we keep the regulation of social distancing, of producing vaccine cards in public spaces, in order for us to continue functioning happen.
Well,
so let's hear what I can do that.
Business for South Africa agrees with you and says that only the vaccinated should be able to go to restaurants, to retail spaces. Some suggesting that restrictions around alcohol sales would make a huge impact on the vaccination drive. But we have such a low vaccination rate where skepticism outweighs acceptance of vaccines. Can you ever think of anything like this? The backlash could be huge and very damaging politically, economically, and the like.
Not really. I think, for me, that's exactly why these international countries respond this way, is that they've seen that the leadership in South Africa has not been that positive. Secondly, the response by us as citizens has also been very poor in terms of vaccinating. So all this really is the fact that we are not taking responsibility ourselves. That is, all of us through our life cycle, we've always vaccinated. And suddenly, everyone is a scientist, everyone knows more. I think what we do know is that actually, if you're vaccinated, although you may be infected, but the cost to public, whether it's in the hospital, to your family, etc., is much less than when not vaccinated. So really, let's rise beyond our own beliefs. Let's do what is right for ourselves and for society by going there and vaccinating.
Sanisha, if government wanted to implement vaccination mandates or restrict some public areas, even if it wanted to, does it have the political capital to do so? And I'm asking this in light of the ANC saying that it got punished at the polls because of previous lockdowns, although I guess you could say, okay, we've just come out of the election, so that does give the president more room to maneuver right now.
Yeah, I think that argument about getting punished at the polls is not necessarily one that you could align to the COVID-19 lockdown measures. I mean, the ANC was really not performing well in previous elections and we didn't have lockdown. So I think that's a bit of a cop-out argument by the party. But I think in terms of the government and asking government to enforce mandatory vaccination programs or even get the, as Lomkhile was saying, getting the industry to enforce and apply and ensure that these regulations are being met. It's going to be a difficult one because we have quite a few rights in this country, in our country, and our rights are very important. We have a Bill of Rights, we have civil liberties. When does the state encroach upon your personal freedom, your freedom of movement? Can the state tell you that you can't go to a certain place because you haven't been vaccinated or you haven't got your vaccination card? All of these things become quite a dilemma, particularly where you have the kind of enforcement of your rights. And I think this is where a lot of the tension, a lot of the challenges and the complexities arise, because at the end of the day, we also want, as Lomkhile was saying, people to take responsibility for their own self-regulation. We want them to change behavior. We want them to understand that even if your right is to vaccinate or not to vaccinate, you must remember that you're creating a spiral snowballing effect in terms of how you're putting other people in society at risk. So there's a collective responsibility here for all of us, whether we change it in the family, whether we change it in our communities, or whether we change our behavior in broader society. But I think for government, the challenge is going to be, one, do you trust the government to enforce the rules? Secondly, do you actually believe that the institutional capacity of the state is able to achieve what they want to achieve? Right now, the level of distrust in government is quite high. The level of distrust and apathy towards state institutions is quite high. You don't want to actually have a government now that essentially may use this as an opportunity to start, blurring the lines and entering into gray areas. But on the other hand, what does government do in order to get people to change their social consciousness, their behavior? And basically, I completely agree with Lomkhile. We all live in family contexts, whether it's extended or personal family spaces, where you've got to now start thinking about how do you self-police, and not necessarily only thinking about, it's the government's responsibility. That's the social contract between state and society.
So, Nisha, talking about distrust, there was some criticism after the president increased the numbers allowed to gather just in time for elections, for those rallies ahead of that. So now if he suddenly decreases gatherings ahead of people's holiday time, possibly a backlash there.
Yeah, not to be facetious, but it didn't really help for the ANC at that point. But I mean, I think the challenge is the way we conceptualize elections as well. We conceptualize elections in a very linear way. It has to be going out and campaigning door to door, because you have to have that interface with the community, with voters. You've got to basically have a stage where you have song, dance, and whatever else that goes on with an election manifesto launch. And if you didn't do that, you were essentially disabling yourself in terms of thinking much more broadly, thinking much more coherently about how do you redefine election campaigning. I think for me, all political parties don't see election campaigning outside of whether it has to be a roadshow, whether it has to be, going into communities and making these very ridiculous promises that we're going to, get rid of corruption, we're going to do this, we're going to do that. None of them spoke about the fact that, there was this whole 66 councils where none of them spoke about coalitions. What are we going to do with coalitions? So I think at the end of the day, this kind of linear approach to election campaigning means that you've got to rethink how do you want to do elections? Because this now means that the kind of approach to democratic processes has to also change. We saw in Malawi that, they had an election, young people came out, but I think in South Africa, we still think of elections in the traditional sense of a democracy. The point about this is we also don't know whether we've tested. I mean, we've seen some of the challenges around the electronic devices that the IEC were using. There were challenges to that. But we also got to think about how do we deal with electronic voting? Are we there yet? The third point I want to make about this is communication. I think what Lomkhile was saying is critical. Does government communicate enough about what they are doing. I know a weekend trying to increase vaccination doesn't really make sense to me, because you can do a Vuma weekend, you can increase a Vuma weekend, but you've also got to have your champions in society. Take those ward councillors, let them become champions of why you need to vaccinate, why you need to get people to come more and more into vaccination centres and increase the vaccination rate that we have in terms of number of people that are vaccinated.
I'd like to pick up on that again. But Lumkile, if we look at the economic impact here, given the travel bans, and you can comment on what the health department has said are unjustified bans, but given those, surely one of the responsible things that government might do is encourage interprovincial travel, is encourage South Africans to go out and explore their country, of course, without putting lives at danger. And it's complicated because a lot of the infections are in Gauteng, and we like to travel everywhere. But surely that is on the president's mind.
In fact, what DIRCO has done is to lean on heavily on a number of these countries, particularly the UK. I saw Clemens Bonyela tweeted sometime today to the effect that British Airways will be reintroducing back the flights, which is very positive, because we're expecting at least about 300,000 British tourists in this festive season. And the weather, Francis, you've seen how horrible it is at the moment in the UK. And therefore, that our government was able to lean on the UK, and that they've allowed British Airways as well as Virgin to fly is very encouraging. However, it doesn't mean that we should then not, because of that development internationally, domestically, we should introduce restriction. It means basically that we should allow people to travel. But more important also for me, I go back to the point Francis have made, that I'm hoping that the president will make a much stronger view or position about vaccination. Remember that in the work done by the NISCREM group led by Nick Spalls, we've seen that the impact of lockdowns, whether from schooling that dropped tremendously, from hunger that deepened, particularly in female-headed households, and the high levels of unemployment as well that we've seen. So really what is important here for me and for many South Africans who are in a position of influence is to work harder to encourage vaccination. And in doing so, therefore, we allow people to travel within the restrictions of self-regulation, as well as what I was saying earlier around the hospitality and restaurant sectors, who then institute much stronger restriction, including permission to come in and stay in a restaurant by producing a vaccination card. If you do that, we'll be able, over time, I think, to bring more people into the net of vaccination, at the same time allow the economy to operate, because we know that any restriction will lead to high prices, because locking down means that the supplies are lower, therefore the prices of goods and services go up, impacting on prices and inflation, and making it very difficult for many households to afford food and other services because of these lockdown consequences.
Yeah, again, that call from business saying, maybe it's time to restrict the unvaccinated so that not everybody has to be restricted. We're only starting to see how that is working in some European countries, and there has been a backlash. Sanusha, Lumkile picked up on this. Klesa Monyela from the Department of International Relations and Cooperation saying, yes, the British Airways will resume flights. And it does seem like the government has been working behind the scenes. We know that Naledi Pandor, the minister, spoke to her counterpart in the US. So lobbying for South Africa here. Unfortunately, these travellers will still face huge quarantine restrictions, possibly when they go home. We were saying on the ground at OR Tambo, it doesn't seem like there's much activity from Virgin Airlines, even though Klesa Monyela saying that they're still flying. I guess this just makes government's job harder. Maybe, yes, we can start those flights up again soon, but we've got to pull people to South Africa. The marketing wheel has to start turning again.
Yeah, I mean, it's going to be a big logistics operation, because now as much as people are going to come into the country, you've got to have the quarantine, you've got to basically add more cost to the travel that they're coming in addition to the hotel cost or accommodation cost. They've also got to have quarantine costs. I mean, the UK did this with South African citizens traveling to the UK. I think there was a 14-day period in which you had to quarantine in a particular hotel, which can go up to 40,000 rand, for 14 days or whatever. So there's a whole added layer of costs and financial burden that then ends up on the plate of the traveler. The question is, are we going to see people say, well, is it worth it? Now, Lamkela made a fantastic point about, where Britain is right now in a winter, and of course Europe as well in terms of the winter. But again, if you can go to another place where there's no travel ban, where there's no kind of added burden, let's say Mauritius, or even fly into Spain or go to Costa del Sol or the south of France. I mean, if that's what the British citizen is going to do, they're going to reevaluate the costing. So I think it's not enough to just say we've opened up the travel ban, we're allowing British Airways to fly at least once a day to Cape Town or OR Tambo and any other destination in South Africa. But it's also about the fact that we must remember South Africa is a transit airport as well. It's a transit destination going into Botswana, into Zimbabwe, etc. So it's also that added burden as well. What happens across the border, not just at the border, but also behind the border. And I think those are some of the challenges. One of the things I want to pick on that what Michaela talked about is we also have to encourage ourselves to think about South Africa as a place to visit internally, as a tourist destination. It's not always to travel outside of our borders. I mean, in China and India and other countries, there's an interesting subsidization for domestic tourism. And that is key. We've got beautiful places around South Africa where we can travel. But I think we tend to, like we look at elections, we tend to look at travel in an export industry kind of approach. It's always linear. We've got to go outside in order to enjoy ourselves. But I think we can start thinking about how do we reinvigorate and reorientate those many heritage sites that are now probably under duress because they don't have the finances because of lockdown measures, but reestablish that. And I think that's what the imagination we need to create in South Africa, is that we can visit within the borders of South Africa, and there's a lot that we can do. But we also need the external tourism, but we don't also need to only be dependent on that and say, well, if you're going to have a travel ban, there's no resources coming into our coffers. I mean, you can see, Western Cape is lovely. There's so many, Mpumalanga is beautiful. There's so many beautiful places in terms of not coastal cities that we can visit.
Yeah, and so many people hoping that interprovincial travel won't be touched today or in coming weeks because of the season we're entering into. So, Nusha, I'd love your comment on what was said earlier on the show by the co-chair of the AU's Vaccine Delivery Alliance, the Nigerian doctor who's gone viral for speaking out very strongly against these travel bans. And she blamed the complacency of African leaders as well. For example, Boris Johnson, the head of the UK, held a press conference yesterday, and he didn't talk about the science and the transparency of South African scientists. She was suggesting that maybe world leaders would be more careful if they knew that African leaders would get on the phone, that African leaders would lobby together and say things like wholesale travel bans are unacceptable. Your comment on that?
Yeah, I mean, that video was very powerful, and she came out very, very emphatically to say that, it's not just about what's happening in Western capitals or other capitals where they are scared. I mean, they are really scared about how this is going to increase their infection rates, put more pressure on their health systems. But Africa also needs to make some kind of statement. And I think what was really interesting about what I took out from that message is how these new variants of the COVID-19 pandemic and the virus is going to be used as non-tariff barriers in terms of trade, in terms of pushing what was also coming out very interestingly in some of the reactions that I saw to the video, and that was, is this now another spike for pharmaceutical companies to find another avenue of revenue? I think in the video she made a very interesting comment about how much Botswana had to pay per vaccine.
All right, Sanusha, I'm sorry to have to cut you off. Welcome to our viewers from SABC2. We are going to take you live very shortly to the Union Buildings in Pretoria, where President Cyril Ramaphosa is